Welcome to Geological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from LASA to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast.
Hi, everyone. I'm Dr. Lisa Lapwing, and in today's talk shop, I'm going to share with you some information about BPH. I have been a specialist in men's health or andrology for over a decade, and I'm super excited to be here with Michael Max giving you guys some pro tips. So, what is BPH? BPH is benign prostatic hyperplasia. It's a non-malignant increase in the growth of the prostate organ, and while it is normal for the prostate gland to grow throughout a man's life, he can experience complications if it begins to impede or even block the flow of urine. This is a very real condition that you are highly likely to see in your clinic, especially if you're treating older gentlemen. And it can be really uncomfortable and disruptive in a man's life. I want to make note here, just as we start to dive into our understanding of BPH, that this increase in growth of the prostate organ is prostate tissue. It's not a swelling of the prostate, which I think is kind of our perception about that. And as we're looking into the TCM components of this, we may automatically think damp. But damp's not always the case because it's an increase in the growth. What is one of the causes or the reasons behind this growth? It is believed to be caused by the stimulation of dihydrotestosterone, big hormone, and it is present in the male body from puberty through life. It is produced in the prostate from testosterone through the mediation of the enzyme 5-alpha reductase. Hormones are causing this as a man ages. And this steadily increases as the presence of these prostatic proliferative estradiol hormones also increase with age. So what does that mean? The size of the prostate's growing as gentlemen age, and it's causing urinary issues. If you heard my talk a few months back with Michael Max, we did touch on BPH because it's a very disruptive condition, but it's also a very treatable condition. Let's jump into some biomed symptoms since we've already discussed one of the main causes of BPH. Some of the symptoms you may be seeing your patients present with in the treatment room are frequent or urgent need to urinate, and increased frequency of urination at night or nocturia, difficulty starting urination, weak stream, or a stream that stops and starts, dribbling at the end of urination, and the inability to completely empty, completely void the full bladder. I see these symptoms a lot in my clinic, and they do affect a person's quality of life, and there's a lot we can do for it. That's the great news. You may also be on the lookout for some less common signs and symptoms, which can include urinary tract infection, inability to urinate, or blood in the urine. If we're bordering on some of those symptoms, we definitely want our patient to see their doctor, especially if we're seeing that inability to urinate. We're in an emergency state, so make sure your patient understands that. And if you're not seeing that in front of you, but your patient mentioned this has been an issue before, I highly recommend you suggest they see a urologist, if not at least their GP. Another important thing to note about BPH, the prostate, is that the actual size of the prostate is not necessarily equal to the severity of symptoms experienced. So anybody can have these symptoms based on whether their doctor has told them they have a big prostate or a small prostate. They can still have some of these discomforts that are very treatable with Chinese medicine. Before we jump into that, which is always the juicy bit for us TCM practitioners, let's talk about a few other common causes that you may be seeing some of these BPH-related, urinary-related symptoms stemming from. A common one I have seen and successfully treated is inflammation of the prostate, a narrowing of the urethra or a urethral stricture, scarring in the bladder neck as a result of previous surgery, bladder or kidney stones, problems with the nerves that control the bladder, or cancer of the prostate or bladder. Again, when we see some of those more severe issues, we want to make sure our patient is seeing a Western medical practitioner in addition to us so things don't get too serious and out of anyone's control and become life-threatening. All of these different things we can treat with TCM, prostatitis, narrowing of the urethra, and of course we all know we can do wonders for scar tissue and stones. Another reason we may see symptoms related to BPH or symptoms if a patient is already experiencing BPH symptoms, they may worsen with certain medications such as over-the-counter decongestants, antidepressants, antipsychotics, and or antispasmodics. While we can have an honest discussion with our patients about what the possibility of getting off some of these offending medications may be, you should know it's not the best practice to say, hey, get off this stuff. That's a conversation you want to have with your patient and the rest of their care team, including their doctors. Another component to that is if your patient is on medications that they can't readily get off of, you can discuss many different lifestyle changes, diet, exercise, various things that really can help give them some relief. As a specialist in andrology, I have been educating other acupuncturists and nurse practitioners on the subject of men's health for the last few years now. And there are so many different things we can do to treat these issues. And BPH, in my experience, has responded very well to what acupuncture, herbology, and lifestyle shifts can do. That being said, let's jump into some of the juicy bits about TCM. So, common differentials I see with BPH: kidney yang deficiency, kidney yin deficiency, qi and blood stasis, lung heat with qi deficiency, lower jiao damp heat, and spleen qi deficiency. Some of these differentials, as you can tell, may be a little more organic or related to aging, and some of them, like qi and blood stasis, can be related to injury, or, which I have seen a lot, a result of a botched prostate surgery. Biomedical has a wide range of medications to prescribe for BPH, and that's often the first route a patient's doctor is going to go. The second route is usually surgery, and a lot of these surgeries are very damaging to the prostate and urethra, where they're getting in there, stretching tissue, sometimes cutting tissue away, stretching things, tucking things, and it often causes so many more problems than the BPH was when that patient first walked in the door. So that's a lot of where I'll see qi and blood stasis is post prostate surgery or injury. kidney yang and kidney yin deficiency. It can be either or. Let's talk about some of my favorite points within those two differentials. If we're seeing some kidney yang deficiency, we're looking for a little more inhibited frequent urination at night, the fits and starts of urination. And for that, I love a good bladder 23, REN 3, all the things that can attend to the bladder and the kidneys. Yin deficiency, we're going to see a little more of that frequent but scanty urine, and there's going to be a constant sensation to urinate. Great points for this that attend to yin, kidney 6, kidney 3, and again, bladder 23. Always a winner, you guys. Qi and blood stagnation. This can be stubborn, especially when it comes to that prostate, because it's really a walled-in organ. And I have found when we're treating more of these organic issues, they respond a little more quickly than qi and blood stagnation do. That's not to say they won't respond wonderfully. I've just found it takes a little more time. Here, there might be more difficulty voiding, where there's more just drips rather than a clear, thin stream of urination. So we want to unblock those channels, remove that qi and blood. Spleen 10 is a great point for cooling the blood, removing stasis. The same with large intestine 4. That jumps us over to lung heat with qi stagnation. With our lung heat and qi stagnation, there may be a little more dripping, a thin stream, or dull pain and distension, fullness of that lower abdomen area, paired with panting or coughing and chest depression. So we want to work our lung organ here. Lung 7 is an empirical point for blood in the urine, so take that little nugget with you, or urine retention due to failure of the kidneys to grasp the qi. What a great point to use in this condition. We're also going to want to clear some of that heat. Large intestine 11 is a fabulous point for that. As we jump down to lower jiao damp heat, we're looking for inconsistent flow, maybe burning hot urine, or it's rough and painful. And we'll see some of those damp signs in the pulse and on the tongue. Want to drain damp? Spleen 9, lovely, beautiful choice. Stomach 40, another great point for damp phlegm. And if we want to pull a little heat out of that liver channel, liver 2 is an excellent point to do the trick. And we'll finish up with spleen qi deficiency. We're going to see those spleen qi deficiency signs. Sagging lower abdomen, maybe the desire to urinate, but the inability to do so, scanty amount, lassitude of spirit, they have a low appetite. So here we go. Let's boost some spleen qi. Stomach 36, spleen 6. Get that middle jiao rocking and rolling. So these are the most common differentials I see. That's not to say you're going to see something else in the clinic or an overlying factor such as hypertension or something else you may need to attend to before you can really hone in on this BPH. Within my courses that I teach, we always look at some base points that can handle most andrological issues, BPH, ED, PE, low T, all these buzzwords we're hearing on late night commercials, right? Acupuncture works great for this stuff, you guys. And I really love teaching this information because it works. You guys will be able to get out there and use these points I mentioned in your clinic with these patients tomorrow. And that's what this shop talk is all about. And I'm so excited to be here and offer this information to you. So you guys can find me out there on the interwebbings at www.whole-healthacupuncture.com, or you can reach out to me at lisa.whacupuncture@gmail.com. I've taught some courses through FSOMA. I have some bigger, more exciting, juicy things in the works, and you can connect with me anytime. If you want to just check in about a patient, if you want to chat my ear off about something, or literally just talk shop. I have a lot to say about andrology. I have so much more to say and teach you about BPH itself. What I want you guys to go home with today is knowing that you can have a great effect on men with BPH, even starting with using those handful of points I introduced you to today. Reach out to me anytime you want at the information given, and you can also visit the show notes of this episode for more information. I want to thank Michael Max for having me, and I hope to hear from you all out there in the ether.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. LASA OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit lasaoms.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at lasaoms.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.